One video, one habit, a better life after 50. Over 60. Do these 6 checkups to stay strong, sharp, and independent. Did you know, according to the CDC, nearly half of adults over 60 miss at least one important health screening each year? Many only discover health problems when it is already too late. Picture a quiet morning. Sunlight spills through the window. Margaret, age 72, is pouring herself a cup of tea. She moves more slowly now, pausing slightly as she stands. Her hand grips the edge of the table. Outside, birds are singing. But inside, she feels a quiet worry. Will I be able to walk to the park on my own next summer? I have seen it happen to my own father, a strong man all his life, suddenly becoming weaker. All because he skipped a few checkups that seemed simple at the time. He always said, "I am fine, there is no need to see the doctor." But the truth is, every time we skip a checkup, we lose a chance to stay healthy, sharp, and independent for more years to come. Research from the Mayo Clinic shows that early detection of heart disease, diabetes, or eye problems can reduce the risk of losing independence after 70 by up to 40%. It may sound big, but it all starts with simple checkups. No pain, just a few minutes. What makes many people grow weaker faster is not age itself. It is those quiet moments when we say, "I will deal with it later," when it comes to our health. So, which 6 screenings will help you keep your legs steady, your mind clear, and your heart strong for many more years? If you find this video helpful, please like, share, and subscribe to Senior Healthy Tips 50+. Here, we do not just share knowledge, we share love. Love for our parents, our grandparents, and for the days when we too will grow older. Adults over 60 should treat regular health checkups as a natural part of life, like tending the garden in your backyard so the plants stay green and thriving. Each visit is a chance to spot hidden problems early, from blood pressure and heart health to vision and hearing, helping prevent dangerous complications. This not only protects your independence, it keeps you strong enough to enjoy precious moments with your grandchildren, to take peaceful walks in the park, or to prepare dinner with your own hands. It is the key to not just living longer, but living well and preserving your dignity to the fullest. 1. Blood pressure check. High blood pressure, also called hypertension, has long been known by doctors as the silent killer. It often causes no clear symptoms for years, yet it can quietly damage the heart, blood vessels, brain, and kidneys. Many of my patients only discovered it after a serious complication, like a stroke or a heart attack. That is why I always remind them, do not wait for your body to speak before you act. For people over 60, checking blood pressure should be as natural as drinking a glass of water in the morning. The World Health Organization recommends having it measured at least once a year. But if you have risk factors like being overweight, diabetes, smoking, or a family history of heart disease, you should check more often, every 3 to 6 months, or even monthly. Measuring blood pressure today is simple. You can go to a clinic, a community health station, or use an electronic device at home. What matters is measuring it correctly. Sit and relax for at least 5 minutes before measuring. Avoid coffee or smoking right before. Keep your arm at heart level. Measure at the same time of day. For example, in the morning. This helps get more consistent results. The ideal blood pressure for older adults is often recommended below 130/80 millimeters of mercury, but your exact target should be personalized by your doctor based on your overall health. If your numbers are higher, your doctor may guide you to change your diet, reducing salt, eating more vegetables, drinking enough water, adding light exercise like a 30-minute walk each day, and if needed, prescribing medication for control. I have seen many patients improve their health within months by making these changes and checking their blood pressure regularly. They felt lighter in the head, slept more deeply, and most importantly, reduced their risk of stroke, the #1 cause of losing independence in older adults. Take Alina, for example. At 72, she thought she was healthy because she had no symptoms. One day while at the supermarket, she felt slightly dizzy and stopped by a nearby health station. Her reading was 180/95. Thanks to timely detection and regular follow-up, her numbers dropped to 128/78 in just 4 months. She was able to keep her morning walks and care for the flowers in her front garden. 2. Cholesterol check. Cholesterol, especially LDL, often called bad cholesterol, can slowly build up as plaque along the walls of your arteries when levels are high. Over time, these plaques narrow the arteries, blocking blood flow to the heart and brain. This raises the risk of heart attack and stroke. The dangerous part is that this process usually has no clear symptoms until a serious event happens. Many people discover it too late to act in time. For adults over 60, regular cholesterol checks are not just about knowing your numbers. They are a way to actively protect your independence and extend your healthy years. According to the American Heart Association, adults should get a full lipid panel at least every 4 to 6 years. However, if you have risk factors like a family history of heart disease, diabetes, high blood pressure, being overweight, or smoking, you should shorten that to every 1 to 2 years, or as your doctor recommends. A cholesterol test will include important measures LDL, or low-density lipoprotein, which should be kept low to prevent plaque buildup. HDL, or high-density lipoprotein, the good cholesterol that helps clear excess fat from the blood. Triglycerides, which, when high, also increase the risk of heart disease. General goals for older adults are LDL below 100 milligrams per deciliter, HDL at least 40 for men and 50 for women, and triglycerides below 150. Your personal targets may vary based on your health condition. If your LDL is high, you can lower the risk by reducing foods high in saturated fat and trans fat like fatty meats, fried foods, and industrial pastries. Eating more vegetables, fruits, whole grains, and fatty fish rich in omega-3. Staying active with regular exercise, such as brisk walking for 30 minutes each day. Following your doctor's treatment plan, including medication if prescribed. A cholesterol check is not just another box to tick on a health checklist. It is a silent shield that helps you prevent heart problems, and it protects your later years so they remain healthy, fulfilling, and independent. 3. Diabetes check blood sugar. High blood sugar over time is one of the most silent yet dangerous threats to the health of older adults. When blood sugar regularly rises above healthy limits, the body begins to suffer damage deep inside. Many people do not realize it until serious complications have already happened. The retina in the eyes can be damaged, leading to blindness. Kidney function can decline, progressing to chronic kidney failure. Nerves in the feet and hands can be harmed, causing loss of sensation, making it easier to develop sores and infections, and in severe cases, requiring amputation. Even more concerning, Recent studies show that chronic high blood sugar can raise the risk of dementia and Alzheimer's disease in people over 60. For these reasons, regular blood sugar checks are essential to detect prediabetes or type 2 diabetes early, so you can take action in time. For people over 60, the American Diabetes Association recommends testing at least once a year. The two most common tests are A1C, which reflects your average blood sugar over the past 2 to 3 months and does not require fasting. Fasting blood glucose, which measures your blood sugar after at least 8 hours without eating. Numbers to watch: A1C between 5.7 and 6.4% means prediabetes. A1C of 6.5% or higher means diabetes. Fasting glucose between 100 and 125 milligrams per deciliter means prediabetes. 126 or higher means diabetes. If your results are in the warning range, lifestyle changes are the first and most effective step. Cut back on foods high in refined sugar and simple carbohydrates such as pastries, sugary drinks, and white rice. Increase fiber from vegetables, beans, and whole grains to help stabilize blood sugar. Stay active every day, especially with exercises that work the muscles, such as brisk walking, swimming, or light-weight training. Maintain a healthy weight to avoid belly fat, which increases insulin resistance. In some cases, your doctor may prescribe medication to control blood sugar, but regular monitoring and healthy habits remain the foundation. A blood sugar check is not just about finding disease. It is about protecting your vision, your legs, your memory, and your independence. The things that matter most in your later years. 4. Colon cancer screening. Colon cancer is one of the most common cancers in people over 60. The good news is that it can be detected early and treated effectively with regular screening. This disease often develops quietly over many years. It usually starts as small polyps in the lining of the large intestine. At first, these polyps are harmless, but over time, they can turn into cancer. The problem is that symptoms often do not appear until the cancer is advanced, and by then, treatment becomes much more difficult. Colon cancer screening can find and remove polyps before they turn malignant. It can also detect cancer in its early stage, when the cure rate can be over 90%. Experts, including the American Cancer Society, recommend starting regular screening at age 45. For those over 60, staying on schedule is even more important. There are several screening methods. The most common include colonoscopy, which allows a full view of the large intestine and the removal of any polyps found. If results are normal, the typical schedule is once every 10 years, but it may be sooner if you have risk factors. Fecal occult blood test, or fecal immunochemical test, which checks for hidden blood in the stool. This is done yearly. Sigmoidoscopy, which examines the lower part of the colon and is often combined with a stool test. Risk factors include a family history of colon cancer, chronic ulcerative colitis, a diet high in red or processed meats, low fiber intake, lack of exercise, and smoking. If you are at high risk, talk to your doctor about starting screening earlier or doing it more often. Prevention also plays a big role. A diet rich in vegetables, fruits, and whole grains, maintaining a healthy weight, and regular exercise can greatly reduce your risk. Colon cancer screening is not just about finding disease. It is about taking control of your health, keeping your independence, and making sure you can continue to enjoy family meals and gatherings with friends without the shadow of a preventable illness. 5. Vision and hearing check. Vision and hearing are two senses that play a vital role in maintaining safety, social connection, and quality of life for people over 60. When vision declines, even simple activities like reading the newspaper, cooking, or taking a walk can become difficult and even dangerous. A missed step, an uneven sidewalk, or the glare of headlights at night can lead to a fall. Hearing loss can be just as serious. It makes it harder to hear a doorbell, a car horn, or a conversation. It can increase feelings of isolation and even lead to depression. Vision loss in older age is often linked to conditions such as cataracts, macular degeneration, glaucoma, or diabetic retinopathy. If detected early, these conditions can often be treated or managed to prevent blindness. A regular eye exam should include not just a vision test, but also measuring eye pressure and examining the retina and optic nerve for damage. For hearing, the most common cause is presbycusis, the natural aging of the hair cells in the inner ear, or long-term exposure to loud noise. Regular hearing tests through audiometry can detect the degree of hearing loss and help you take timely action. This might include using hearing aids and avoiding letting the brain go too long without sound stimulation, a factor linked to cognitive decline and dementia. Experts recommend eye exams at least every 1 to 2 years, and more often if you have diabetes or a family history of serious eye disease. Hearing tests at least every 1 to 2 years, and immediately if you notice signs such as turning up the TV volume, difficulty hearing with background noise, or often asking others to repeat themselves. Beyond testing, daily protection of your eyes and ears is just as important. Wear sunglasses to block UV rays. Use protective eyewear when working outdoors or in dusty environments. Limit exposure to loud noise. Maintain a diet rich in vitamins A, C, E, and omega-3, which support eye and hearing health. Proactive care and regular vision and hearing checks will help you maintain safety, confidence, and connection with the people you love, instead of slowly becoming separated from the world around you. 6. Heart health check. Heart health plays a central role in the entire body system because the heart is the engine that pumps blood to nourish every cell. For people over 60, the risk of conditions like coronary artery disease, irregular heartbeat, or heart failure increases significantly. This is due to the natural aging of blood vessels, the buildup of plaque, and the long-term effects of risk factors such as high blood pressure, diabetes, high cholesterol, or a sedentary lifestyle. Regular heart health checks not only detect disease early, when symptoms are still vague or have not appeared, but also allow your doctor to take preventive steps and provide timely treatment. This can greatly reduce the risk of serious complications like heart attack or stroke. Common heart tests include electrocardiogram, or ECG, which records the electrical activity of the heart to detect arrhythmias, reduced blood flow to the heart, or heart damage. Echocardiography, which uses ultrasound waves to see the structure and function of the heart, assess the valves, chambers, and pumping ability. Stress test, which measures the heart's response to exercise, usually walking on a treadmill or cycling, to detect hidden coronary artery disease that a resting ECG might miss. Adults over 60, especially those with conditions like high blood pressure, diabetes, high cholesterol, or a family history of early heart disease, should have these tests at least every 1 to 2 years or as recommended by their doctor. Beyond testing, daily heart care is essential. Follow the DASH or Mediterranean diet, rich in vegetables, fruits, fatty fish, and whole grains. Limit salt, sugar, and saturated fat. Stay active with regular exercise like brisk walking, swimming, or cycling. Maintain a healthy weight and manage stress. Protecting your heart means protecting the pump that sustains life. It ensures you have the strength and resilience to enjoy your later years with independence and the joy of being with your family. You know, age is something we cannot stop, but our health, our clear mind, our steady legs, those are entirely within our own choices. Every health checkup is not just about finding illness. It is about making sure you can keep doing what you love, living the life you want, and not having to depend on anyone. I hope you see these 6 screenings as protective fences around the house of your health. The sooner we build them, the safer we are. The more we maintain them, the freer we become. If you find today's sharing helpful, please like, share, and subscribe to Senior Healthy Tips 50+. Because here, we do not just share knowledge, we share love. Love for our parents, our grandparents, and for the days when we too will grow old. So next time a health check appointment appears on your calendar, will you push it aside, or will you walk toward it? Like someone giving themselves more years to live healthy and to live with dignity.